place to be grandfathered in. And that's extremely important that you understand that, because that's your one out. Is if you have a plan in place, you remember the famous line, if you like your health insurance, you can keep it. Well, you can. But the caveat is that if you change it in any way other than adding or deleting a person, a dependent, an employee, whatever the case may be, you then are forced into the exchange. Well, the plans that are grandfathered in are not going to be counted as part of the pool. So actuarially, the premiums on the plans that are grandfathered in won't run at the same rate the premiums over here on this exchange are going to run as. So if you're smart enough to get a policy in place that you like between now and 2014, which is what I highly recommend you do, you have a much better chance at controlling your cost and not seeing these huge cost increases that we're going to see as a result of this exchange and this thing dialing in. So that's a piece of advice that I give to all my clients, and I would give to you, because there is a loophole in there. Again, understand something, if you change the deductible, the co-insurance, the copay, any of that, you are then forced into the exchange. You are then required to buy either from the exchange or outside of the exchange. You're required to buy a government mandated plan, meaning a plan that they put in place and that they approve. So that's how that part of it is going to work. So those are the consequences of the first year, and those are the unintended consequences in terms of premium increases. So when you hear that premiums are going to go through the roof, yes, they are. Okay? And they're going to go through the roof because what's going to happen is these companies are going to see this situation, and they're not going to have any other way to control this because they have no control of it. And eventually what I think is going to happen is the insurance companies are going to walk into the Obama administration one day, assuming he's reelected in 2012, hopefully not. Okay, or they're going to walk into the Department of Health and Human Services, and they're going to lay on the desk and say, here are the bills, here are the premiums. What are we going to do? Because there's not going to be enough money. There's not going to be enough money. This is not going to work. It's not working now in Massachusetts, which is the only living model of this thing we have. It's called the Massachusetts Connector. If you're 35 years of age, family of 4, you have the privilege of paying $13,627 a year for your health insurance. You can buy that same policy in Missouri for about half of that, and in some cases a lot less than that. That's the exchange, and the problem with the exchange is very limited access to multiple plans. There's only 4 carriers in the entire state, okay? And they set the plan designs. They tell the insurance carriers what they can and cannot do. They tell the insurance carriers what they can and cannot charge. So what happens as a result of that is it constricts the marketplace. The other problem with it is they game the system. All right, I'm that 19, 20, 25-year-old guy. Okay, I find out that I've got a cancer, I've got a brain tumor, I've got this issue, that issue, something else. Okay, maybe I need to have a surgical procedure done. I don't have health insurance. I go sign up, they have to take me. They don't have any choice. Okay, I get my surgery done, I'm finished with the surgery, doctor releases me 60 days later, bye, I'm off the plan. That's exactly what is going on in Massachusetts. They game the system. The exact same thing will happen here, because the penalties for the mandate are not strong enough to force people to do this. And so therefore it's not going to happen. The other problem that we're going to see starts in 2011, and this is going to force carriers out of the business. In this bill is a thing called the MLR. The MLR is the minimum loss ratio. The minimum loss ratio says that in large group, the carrier has to spend 85 cents of every dollar on claims, okay, on claims and services for the people that are insured. He has 15%, or the company has 15% to operate on. That's all their overhead, all their admin, any commissions they pay to brokers and agents, everything they do, rent, lease, whatever they do, they've got 15% to operate on. That may work in the large group market. It's going to be tight, but it's possible. In the small group market, the MLR is 20%. That isn't going to work. Let me illustrate why. When you take 600 people on one plan, that's one plan. When you take 600 people on 600 different plans, the administrative cost of that is significantly higher. Okay? You've got many, many more moving parts as a result of that. So what we're going to see happen is we're going to see carriers start to go out of the business. They're not going to be able to survive. I sat with a national vice president last week who came to town to do a radio show with me, and we talked about it. He said, Cary, if we don't get this thing to 25, we're gone. So the market's going to constrict. You've already seen one company close its doors, a company called Megalife, not one that I was particularly fond of, but they're gone. I fully expect to see Republic go, World Insurance go, and American Community go. They'll be the next three because they're the smallest. Mercy Health in Springfield, which is owned by St. John's Hospital System out of St. Louis, they'll be gone shortly after that. We've already seen Preferred Health Systems in Wichita go bye-bye. They saw the writing on the wall, they sold it, and they're out of it. So they're gone. Okay? So we're going to see the market constrict because carriers can't survive on a 20% MLR. Unless that changes, you're going to see the market constrict. And you're going to see fewer carriers in the marketplace offering fewer products. And some folks might say that was designed all along. I'll let you judge for yourself. But that's the reality of what's going to happen here. Medicare taxes in 2013 will go up to 2.35% for those of you greedy capitalists that make over $200,000 a year. And for you greedy capitalist couples who make over $250,000 a year, yours go up even higher than that. Okay? So that's what we can expect in 2013. Let's go back to 2014 for a minute, because that's really the most difficult, that's going to be the biggest problem that we're going to see is when that dials in. That exchange, that federally mandated exchange, is going to come, they're going to come to the states initially, and they're going to say to the states, you have to set up an exchange. Right? And you're going to offer health insurance products on that exchange. The states don't have a choice. They have to do this. If they don't do it, the federal government steps in and does it for them. So that's the way this works. So essentially what you have now is the federal government taking over health insurance in this country and telling the companies and you and I what we can purchase, what we can't purchase, how the plans will be designed, and what we can do. One good piece of news in this thing is HSAs are going to be grandfathered in. They're not offered and they're not shown in any of the plan designs that are in this bill. Platinum, gold, silver, and bronze are what they talk about. None of that is an HSA platform. Also note that in this legislation, they did come after the HSAs and take away your right to buy over-the-counter medications with your HSA money. You can't do that anymore. That goes away. But so this exchange is going to limit what you're able to do. It's going to be forced on the states. If the states choose not to do it, then they'll step in and do it for them. So essentially, as I said earlier, what you've got is this massive concentration of power with the federal government, run by the Department of Health and Human Services, the new Health Choices Commissioner, and the Medicare Commission. What's going to happen to folks on Medicare? Well, if you're on a Medicare Advantage plan like Humana Gold or Coventry Advantra, Mercy Health, Essence, any of those, we'll see how long they last. The MLR they're allowed now is going to be 15%. That's what's going to be cut to. I was reading an analysis this afternoon. They're really ratcheting these things down as much as they can. The ultimate goal is to get rid of them, which is kind of odd because better than 37% of the seniors in this country are on these plans. They like them. Satisfaction ratio with them is over 87%. But the Democrats have never liked these plans. They've always wanted to get rid of them because they work. Okay? Duh. Okay, let me give you an illustration of that. Fraud and corruption under Medicare was $48 billion in 2007-2008. Fraud and corruption under Medicare Advantage plans was less than 2%. But it's the private industry that's not doing the job right. But the good news is there's $250 billion in this bill to go find fraud and waste in Medicare. So rest assured they're going to solve the problem.